Take a close look at the movement in this corrective technique. It doesn't look like much, but the amount of neuromuscular control needed to create a posterior pelvic tilt, flattening out the low back and beginning to restore lumbopelvic posture proves to be quite challenging for the people who need this exercise. In this video, I'm pulling down on the wall with my heels by engaging my hamstrings, and I'm working to ensure I do not push with my hips or my quads. Also, the abdominals need to be relaxed. The movement here should not include an abdominal crunch. We're fundamentally asymmetrical creatures. We are either right or left-handed and therefore left or right-brained. We're also left or right-eye dominant and tend to sit or stand primarily on one side or the other. In other words, what happens is that over time, your body compensates and attempts to remain balanced over an uneven pelvis. The 90-90 hip lift corrective strategy is the most basic and foundational of the lumbopelvic postural corrective strategies. Here we begin to correct neuromuscular imbalance that causes certain muscles to be overused and others to be underused. This causes torsion at the pelvis and positional rotation of the lumbar spine. What that means is your mild scoliosis is not a problem of the spine, but a problem that starts at the pelvis, causing the spine to sit in a twisted position and placing stress on the ribs, the shoulders, the neck, and the head. Getting relief and preventing problems starts with lumbopelvic postural correction. So let's begin. Find an open space close to an open wall and take your place on the floor. Lie on your back with your feet flat on the wall and your knees and hips bent to a 90-degree angle. Make sure your head is well supported and you can relax. Inhale through your nose, and as you exhale through your mouth, perform a pelvic tilt so that your pelvis, your tailbone, is raised slightly off the mat. Keep your back flat on the mat. Do not press your feet flat into the wall and instead dig down into the wall with your heels. You should feel the muscles behind your thighs. You should also feel the muscles on your inner thighs and your outer hips. Can you tell if one hamstring is working harder than the other? See if you can even this out and use both sides equally. Now that you're in position and pulling down on the wall, breathe in through the nose and out through the mouth. Be sure to purse your lips as though you were blowing out through a straw or blowing up a balloon. Lengthen the exhale and use your diaphragm. Perform this exercise twice a day for 4 repetitions with 4 breaths as you hold the position of each repetition. If you're seeing this exercise for the first time, or if you have not yet been assessed, are you wondering about low back, sacral, hip, or knee pain that somehow feels connected? With an accurate diagnosis, targeted corrective strategy, and consistency week to week, over time this can be corrected. It may take a while, but stick with it. It can happen. Do you have low back pain or knee stiffness and pain, and you're wondering if this exercise is right for you? Click on the schedule button. Let's make sure you're not wasting your time practicing exercises that may not help. Thanks for watching, and I'll see you here again soon.